For my partner Simone and myself, we did our project on herpes. Herpes is an infection that is caused by herpes simplex virus, and depending on which part of the virus you have, it affects you differently. The scientific name for herpes is herpes viridae, and herpes is a virus and it is a long-term disease, which means that there is no cure for it, and it lays dormant within the body. Herpes is divided into two sections. It's herpes simplex 1 and herpes simplex 2. We'll get into the difference between the two later on. The signs and symptoms of herpes. So genital herpes is herpes simplex 2, and that includes pain, itching, and small sores appear on your private region. So for females, that'd be the vaginal, and then for males, it'd be the penis. And then cold sores and canker sores are part of herpes simplex 1, which is the oral part. And the symptoms of cold sores would be blisters and sore lips and redness and tingling in your lips. And a lot of people confuse cold sores with like regular bumps on your mouth, but cold sores are different because of the feel and they resemble crackly, bumpy skin. And then canker sores are painful sores in the mouth that can make it hard to eat and talk. And they're like white bumps that line the inside of your cheeks, the inside of your lips, and sometimes on your gums. How and where can you contract this? The herpes 1 is contracted through oral secretions. So saliva, other sores, or sharing objects such as utensils, toothbrushes, things like that. And herpes 2 is contracted through sexual contact, so sex. And the way you get this infection is if somebody who you're having sex with or somebody you come in contact with already has this disease. The cures and prevention. Unfortunately, there is no cure for herpes, but there are medications you can take. If you have cold sores, there are saline sprays that you can take. And if you have the herpes 2, which is your genital area, you have medicine that your doctor can prescribe to you. And the way you can prevent it is you always wear protection when you're having sex, and you don't drink off anybody. And if you do have herpes, make sure that you take your medication. The quality of life. The quality of life for those who have herpes remains the same as the average person without it, because herpes is simply just a health disease that can be treated. Well, not really treated, but you can take medication for it that'll help with the flare-ups. And if you do contract the disease, the first time you will experience a flare-up can be any time between 2 to 20 days when you first contract it. And then anytime after that, it can flare up anytime between several weeks from later or several months from later. Or sometimes you'll never have another flare-up again, but like I said, it lies dormant in your body. The disease is just a very painful disease, but like I said, there are medications that can help with the flare-ups. Right here, we have a picture of the canker sores, which are bumps that line the inside of your mouth. Right here, we have the cold sores, which line the corners of your mouth. And then this picture is the vaginal herpes. And then this picture right here is the herpes on the penis. And then just to basically summarize what herpes is, it is a sexually transmitted disease that is caused by herpes simplex virus. And it can cause sores on your genital area, your rectal area, your buttocks, your thigh, and that's an example of the herpes 2. And then it can line the inside of your mouth and on the corner of your lips, and you can get it from having sex or coming in contact with somebody who has it. The virus can spread even when sores are not present. And the unfortunate thing about this disease is that if you contract the disease while you're pregnant, it's a chance that your child could have herpes as well. That's it.